Janet, thank you so much for joining me. Just start by telling everyone a little bit about yourself. Who's your mob? Where you're from?
So my name's Janet Stajic. I'm a Yidinji Jitterbal woman from Far North Queensland, rainforest country. I was born and raised in Brisbane, where I've lived most of my life. So I'm also an urban Murray.
Janet, tell us a little bit about where your journey as a health practitioner started. Where did you kick off your career and where have you ended up?
Before becoming an Aboriginal health worker, my background was in Indigenous community development and community services. I then started training as an Aboriginal health worker back in 2008 and worked in Aboriginal health worker roles for a few years before moving into program management, policy, and more recently research. As for qualifications, I did the certificates 3 and 4 in Aboriginal and Torres Strait Islander primary healthcare as an Aboriginal health worker, and got my first university degree at the age of 43, where I did a graduate certificate in public health, then a professional certificate in Indigenous research, and I'm currently undertaking a Doctor of Philosophy or PhD at the University of Queensland.
For you, working in this workforce, seeing really closely, obviously, how important it is, what do you think the importance of having First Nations health workforce is?
It's so important. Like many Aboriginal and Torres Strait Islander health workers and practitioners, they're drawn to the role because they see and they experience the health inequalities and injustices that our mob face and want to make change. So quite often they come to these roles with a community development and social justice lens. They're part of the communities they serve, they know our families and their situations, and they can act as cultural brokers between mob and other professionals, health professionals. So they really are the best health advocates for our mob. It's such a unique and specialised workforce.
Yeah, I think that's a really good point, coming with a social justice lens. It's something you don't really get across mainstream health services, and obviously that addresses so many of the gaps that our mob face. For you then, considering all of the extra load that our frontline health workers have to carry, what's the importance of having a national day of recognition for this workforce?
Yeah, it's so deadly to have this national day of recognition. Because there's still such a lack of understanding of the work that Aboriginal and Torres Strait Islander health workers and practitioners do within the Australian health system. And unfortunately, this results in under-recognition and undervaluing of this workforce. So having this day is a way to really celebrate and raise awareness of the unique contributions they make and the tireless work that they do for their communities.
Now, I want you to tell us a little bit about your PhD that you're doing. Your topic is recognition of the work and understanding of concepts of health and healthcare of Aboriginal and Torres Strait Islander health workers and practitioners in urban southeast Queensland. So you've got a real focus on our health workforce. Why is it that you wanted to focus on them for your PhD?
I've been working in Indigenous health research now for about 8 years, and I've learned how research can be used as a valuable advocacy tool for our mob. I started this PhD knowing that I wanted to focus my research project on the Aboriginal and Torres Strait Islander health worker and practitioner workforce. And I came across a paper in 2019 that was co-authored by Carl Briscoe, the CEO of NATSIWID, which talked about the lack of understanding and undervaluing of this workforce, among other things. So it was then that I decided that I wanted to focus on bringing better recognition to this workforce by listening to the stories and experiences of Aboriginal and Torres Strait Islander health workers and practitioners, and also exploring their concepts of health and healthcare. So hopefully, bringing a better understanding by other health professionals and staff.
I think it's so important. I reckon so many of us have Aboriginal health workers, Torres Strait Islander health workers in our families, who've come before us and at the moment as well, and to pay homage to all of the hard work that they've done for our communities. I really can't wait to read what you create, Sis. How has spending your career as a health worker actually informed this work that you're doing now?
like my training and experience as an Aboriginal health worker has been so foundational to my career in Indigenous health. As I've moved through the different roles following that. And, as a PhD researcher, having this background not only helps me engage and build rapport with Aboriginal health workers that participate in this research, but it also helps me in the yarning process and interpretation of their stories and privileging their voices.